How's it going, guys? It's Ryan here. So we're just gonna go over these side effects and how to prevent them when running gear. A lot of you guys, why does my light keep turning off? A lot of you guys run into these side effects, and you don't want to decline your looks and descend yourself. So we got to make sure we're preventing side effects. And there are pretty easy ways to prevent almost every side effect from taking gear. So let's dive right into it. So the first big one is going to be hair loss. No, nobody wants to lose their hair when running a cycle. So in order to prevent this, you can take finasteride, dutasteride. Both of these are 5-AR inhibitors. Dutasteride is a lot stronger. They bind to your scalp and basically make prevent testosterone from converting into DHT. And then you can use ketoconazole shampoo. This binds to the DHT receptor in your scalp and blocks it there, so it helps your hair regrow. And then we have minoxidil, which increases your blood flow in your scalp and can help regrow your hair. And then RU8441, that's kind of a research chemical, but it also works for preventing hair loss. All right, next we have estrogen side effects like gynecomastia, enlarged prostate, acne too is another one that can come from estrogen. So in order to prevent this, we can take DIM, which is a natural supplement, EQ, Masteron, or Primo. These are all injectables that you can take alongside your test to control your estrogen. Then we have daily injections as well to keep your blood level stable. All right, next we have liver toxicity. So this is a big one. Liver toxicity comes from orals and like stuff like tren, harsher compounds. So you can take an injectable glutathione, and this is not only really good for your liver, it's good for your brain, your skin, like just your overall health. A very powerful antioxidant, and it really helps with your blood markers. And then next we can take Tudka and milk thistle. These are natural supplements that help with your liver as well. All right, next we have HPT axis shutdown, which is your fertility, right? Basically, if you don't want to get your fertility shut down to be able to have kids, you have to take HCG, which increases your luteinizing hormone and follicle stimulating hormone. Basically, it helps you stay fertile. And then we have enclomiphene, which is a SERM, and it also keeps you fertile and able to have kids. You can take it as a PCT or on cycle. All right, next we have, let's go to our estrogen side effects. Actually, no, let's do acne. So for acne, you can take isotretinoin or Accutane. This is going to be your best one. Take it at a low dose. This gets rid of your acne. It's the best. And then tretinoin cream is basically a topical form of Accutane. You can take this, apply it on your face. It improves your skin, like your appearance on your face, and it improves your complexion. All right, so vitamin B6. You can also take high doses of vitamin B6, and this will dry your skin and help improve your acne. Next, we have estrogen control, and so basically just control your estrogen with an AI, and this can help prevent acne as well. So next we have our high blood pressure. So in order to be safe on gear, there are three big things we want to keep under control. That's your blood pressure, your cholesterol, and your heart rate. So to prevent high blood pressure, we can take a PDE5 inhibitor like Viagra or Tadalafil, an ARB, which is an angiotensin receptor blocker like telmisartan, or a beta blocker like propranolol or nebivolol. And then there's also guanfacine, which is a prescription medication, also reduces your blood pressure. These are all very good options for reducing blood pressure. Next, we have our cholesterol. So to keep our cholesterol in check, you can take ezetimibe. This is like probably the best one you can take. It increases your good cholesterol and helps lower your LDL bad cholesterol. And then these are all a bunch of natural supplements we can take, like fish oils, citrus bergamot, aged garlic, NAC, magnesium glycinate. And then we have so let's see what else. So for HGH, to prevent elevated blood glucose, you can take metformin, berberine, alpha lipoic acid. These all increase your insulin sensitivity. And then for joint pain, muscle stiffness, you can take collagen, lower the dose, or take an NSAID like ibuprofen. And then last, we have water retention. To prevent water retention, you can start at a low dose, and you reduce your sodium intake. Take low dose diuretics or spironolactone, which is an androgen blocker. So yeah, and then basically make sure to get all your blood work done, your CMP, CBC, apolipoprotein test, and your gamma glutamyl transferase, GGT enzyme, men's hormone panel, cystatin C. These are all good blood tests you can take to measure your blood work.